It's Leanne at Succeed Healthcare Solutions. My next potentially contentious tip around sensory management is around systematic desensitization. So systematic desensitization is well established in psychology. Mental health occupational therapists do use it, particularly around psychological conditions such as post-traumatic stress disorder, severe anxiety. Over the last 10 to maybe 16 years, my philosophy has been kind of to adopt that approach when it comes to sensory needs. So if, say, for example, someone's goal is they want to be able to ski at the Alps, but they have a sensory intolerance to snow or to cold, it's going to be pretty hard to adapt the environment. Yes, they could go to one of those indoor adventure centres where it is kind of like skiing. That's one way. That's also a helpful way. I tend to try and take a graded approach. Now, true systematic desensitization is where you might even start with them just thinking about the stressful event, and if they have an increase in sort of fight-flight response, we help them to practice relaxation at that time. For sensory intervention, sometimes it may not need to go that far back. You might be able to start further up kind of the chain. For example, pretending to play at the snow with some Barbies, using some ice cubes with the child and getting them used to the feel of that. You might build up eventually to things like going to a mountain where it's sort of the line between where the snow hasn't yet started, where it has started, and they can do a little bit of interaction off the snow and a little bit on the snow. You might take them to a warm and comforting lodge where they can be inside, where it's snug and warm, and then have moments of exposure out in the snow, and gradually over time build that up. That way, we're helping them focus on achieving their goal. Now, it may well be, and most likely will be, that we'll need to help them remember to use some of their relaxation strategies when they're exposed to those environments. And also, the more they're exposed to them and maybe have okay or even maybe positive experiences, all those little experiences are like a deposit in the bank, and they kind of build and add up so that they have more positive memories of it. And then I think it's maybe not so big to overcome. It doesn't mean they're going to be necessarily fully comfortable, but at least if they can achieve their goal, they'll get that sense of accomplishment. I hope that's helpful.